Well, thank you everyone for making the time to join us today for the At the Intersection Addressing Homelessness During Pregnancy for Women and Gender Diverse People webinar. Next slide, Barb, please. I just wanted to take a moment for a land acknowledgement. I'm Stefania. I'm with the Women's National Housing and Homelessness Network. I'm the Director of Advocacy and Communications. I'm calling in from what's colonially known as Vancouver, which is the traditional and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations. I also encourage everyone to share in the chat if you would like your own land acknowledgement and where you're calling in from. We'd also like to acknowledge and recognize that Canada is a settler colonial state on Turtle Island, which for generations has been governed and inhabited by Indigenous peoples practicing traditional ways of doing, knowing, and being. We acknowledge that the current homelessness crisis disproportionately impacting Indigenous peoples is a direct result of colonial and patriarchal policies that have dispossessed Indigenous peoples of their lands and homes and commodified land and housing as profitable assets, leading to the concentration of wealth with a privileged few. Next slide, please, Barb. So just some quick housekeeping and then we will get started. Our session today is recorded and it will be posted on YouTube and shared within the week. We are also committed to making this a safe space and accessible for everyone, and I'll be dropping some housekeeping items in the chat. And please use the chat to let us know if you need any help. It's also where you can post if you have any questions. I will be logging those, and then we have a portion at the end for a Q&A where I'll be moderating that. So questions will come later, but please feel free to post them at any time. Next slide, please. So as I mentioned, I'm Stefania with the Women's National Housing and Homelessness Network. We're focused on preventing and ending homelessness for women and gender diverse people across the country and advancing the right to housing for all. At the Intersection is a webinar series that we've started promoting women and gender diverse people's efforts toward housing equity and solutions to homelessness by spotlighting innovative services, programs, and movements at the intersections of the right to housing, disability rights, homelessness, drug policy, family rights, health, sex worker rights, race equity, indigeneity, gender rights, and much more. Please connect with me if you're working on something you'd like featured in our series. We have more planned each month. And make sure you follow us or subscribe to our newsletter to stay in the loop. I will now pass the mic over to Barb Chizzy, who will introduce herself and dive into her presentation.
Thank you so much, Stefania. It's such a pleasure to be here today, everyone. And I am going to be talking today together with Carolyn Mora and Stacia Stewart. And we're going to be looking at addressing homelessness during pregnancy for women and gender diverse people. So I'm going to start off the presentation to begin with, and then I'm going to be passing it over to Stacia Stewart, who is from Parkdale Queen West Community Health Center and has information that she's going to be sharing from a service provider perspective. And Carolyn is going to be sharing some experiences as an expert with lived experience, and we'll be sharing some examples of her attendance at a symposium that we held in June 2023. I'd like to acknowledge the co-investigators for this. This is a research study that was done together with Toronto Metropolitan University and Dr. Sapali Guruge, who was a professor from Daphne Cockrell School of Nursing, and also Dr. Caitlin Schwan from the Women's National Housing and Homelessness Network. And our community collaborator was the Young Parents No Fixed Address Network. You can see their icon at the bottom right-hand corner of the screen. And I will be giving a little bit of information about what YPNFA, Young Parents No Fixed Address, stands for. This study was, or the symposium, the event, and this webinar series was actually funded by a Social Sciences and Humanities Research Council of Canada Connections grant, and I'd like to acknowledge that as well. So just as Stefania gave a land acknowledgement, I'm also going to give a land acknowledgement for Carolyn, Stacia, and I. We are all based in Toronto, and I'd like to acknowledge that the land in Toronto is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat people, and it's now home to many diverse First Nations, Inuit, and Métis people. And we're honored to be able to be here today to presenting from this land. So a little bit about what the objectives are for today for the presentation is we're going to provide a bit of background about something called a gender-based analysis plus approach to dealing with this crisis of homelessness during pregnancy. Our perspective for the presentation is based from Toronto, but a lot of what we're talking about is going to be very applicable to situations across the country. We're also going to share an animation video that was created from by myself and the community partners as a knowledge mobilization and advocacy tool. And this is something that's been launched on YouTube. We will share the link with Women's Housing and Homelessness Network so that if you want to view it again after this presentation today, you may do so. And then the big part of what we're going to be doing today is talking about the results and overview of a symposium that we held in June 2023 that was focused on homelessness during pregnancy. So before I get started to talk more about the symposium, I'm going to be talking first about our collaborator, community collaborator, YPNFA, Young Parents No Fixed Address Network. So this is an organization that was created that is over 40 different agencies in Toronto. We meet monthly and we address the needs of pregnant people facing homelessness in Toronto. And some of the collaborators on the network include women's shelters, young parent agencies, social service agencies, child welfare organizations, Toronto Public Health, and various hospitals and universities, and that's just to name a few. And I'm really grateful to have been working and part of the network for the last 15 years with YPNFA. They're truly a really inspirational and passionate group of people, and we always have amazing meetings every single month. And Stasia and I have been a part of that network for a very long time together and have collaborated for a very long time together. So I'm also a part, and so is Stasia, part of a network, a subcommittee of the YPNFA network called PATHS. And PATHS stands for Providers Advocating Towards Housing Sustainability. And it's for people who are facing pregnancy. And our aim is to try to have pregnancy labeled as a priority population when it comes to housing needs. And so the impetus for the symposium that we held last year actually arose from those discussions that we had in that PATH subcommittee meetings. So a little bit of background about YPNFA. It was convened by Toronto Public Health in 1997. And it was for two main reasons that it was convened. So it was first to examine the increasing numbers of pregnant young people who were facing homelessness in Toronto. And the second reason was following this tragic death, unfortunately, of a 5-week-old baby in a shelter in Toronto. And this was really due to a lack of collaboration between service providers. And so this network was formed and convened by Toronto Public Health to ensure that we have this continuation of strong interprofessional collaboration between our network partners and within the agencies, so that this kind of tragedy would not happen again. So a little bit of background for all of you. And I have references at the very end, and we'll share the slides with everybody as a PDF so that you'll be able to have access to the slides and to the references. So every year, it's estimated that 300 infants are being born into homelessness in Toronto. Pregnant people facing homelessness, we know that they have less access to prenatal support. They have increased rates of both intimate partner violence and mental health issues. And infants born into homelessness are also at increased risk of preterm birth and low birth weight. It's also known that unsafe and transitory housing can impair the interactions between the birthing parent and their infant, and that can lead to complications later on as well. So one of the main barriers of what we're seeing with this population is that there's siloed policies, meaning that different sectors are not collaborating with each other, or we have really inaccessible and complicated policies that people need to follow. So for example, There's many shelters that are housing pregnant people that they don't allow children. So this means that somebody who has given birth will need to switch to a different shelter after they've given birth to their baby. So this often leads to frequent relocation and fragmented access to essential prenatal and postpartum supports. So during one of the studies I conducted during COVID-19, there was a study that showed that unsafe and transitory housing, this frequent relocation, was happening to a lot of the women in the study. And so, for example, I found that the participants moved on average 3.4 times within an 8-month period. And the range was between 2 to 7 times within 8 months. And that could have been a move anywhere from a shelter to staying with somebody and couch surfing to being unsheltered and being on the street or staying in a tent, to then staying in a different type of shelter or different type of accommodations. So there was a lot of frequent relocation of what we were seeing at that time. And that is actually consistent, what we see as well, not just during COVID, but it was worsened during COVID. So these frequent relocations impacted the participants' mental health. It caused feelings of stress, anxiety, and depression, and led to gaps in accessing essential prenatal and postpartum support. So additionally, we know that a lot of the clients that we're seeing are newcomers to Canada. They have particular challenges navigating the shelter system. And when they do end up in the shelters, they're not suitable to meet the ethnic needs of these clients. So as well, these long-standing male-centric approaches to service provision. So we don't know the extent of the enumeration of the issue of homelessness during pregnancy. And so a lot of the policies that are being developed based on data that is from people who are unsheltered on the street. So that meaning, and that's traditionally males who are on the street, who are being enumerated, are being counted. And so a lot of the policies that are being developed are very male-centric, and a lot of the service provision that we have in place is very paternalistic. There's a lot of hoops that people need to jump through. And there's a lot of expectations for programming for the clients who are attending those shelters. And so there's a lot of feelings with the people lived experience that they have mistrust, and it can hinder them from seeking services. So we also know that pregnant people who are facing homelessness can be fearful about the threat of losing their infant to child protection services, because homelessness is perceived to be an adverse parenting behavior or neglect. And even though we know that that's not true, but that is the perception. And when emergency shelters are available, they don't provide optimal living environments for people who've given birth. There's limited space. The activities are really highly monitored. Lots of surveillance that's occurring, and this can feel stifling and oppressive. And as I mentioned before, that there's this lack of culturally appropriate care. So what we've decided to do when we were creating this symposium and looking at this project is using a gender-based analysis plus approach. So this is something that is used by the government of Canada. You may have heard the phrase a lot. I know it's used by the Women's Housing and Homelessness Network. And so basically, this is meaning to say that the experiences of women, of homelessness for women and gender diverse people, are very distinct from men. So meaning that the women tend to experience hidden homelessness. So they're more likely to rely on relational, precarious, sometimes dangerous housing options like couch surfing or staying in exploitive relationships, or trading sex for housing. So the greater visibility of men in the homelessness sector means that the existing policies that are in place and the services tend to be male-centric, and they fail to meet pregnant and postpartum women and gender diverse people's needs. So if we use a gender-based analysis plus approach, it's going to acknowledge these intersecting identities, that certain groups of women and gender diverse people are disproportionately impacted by homelessness. And that can include Indigenous people, recent immigrants, and those experiencing intimate partner violence, poverty, and substance use. So why did we feel that we needed to have a symposium? So using our collective knowledge at the PATHS committee, this subcommittee called Providers Advocating Towards Housing Sustainability, we felt that we wanted to be able to have a voice to go forward and a way to be able to address these siloed policies that we're seeing and in shelters, as well as these fragmented social services that are causing barriers to essential prenatal and postpartum support. So we felt that there was this need for knowledge exchange between key stakeholders, so including people with lived experience, service providers, researchers, and policymakers. So we felt that in order to be able to address these siloed policies, we would hold a one-day symposium, and we did so on June 8th, 2023. So these are some pictures. All of the pictures that you see here of people are taken from the symposium directly with permission for them to be able to use their images. So as I mentioned, on June 8th, we held the symposium and was focused on homelessness during pregnancy. And so the symposium was intended to create an opportunity for these key stakeholders to exchange knowledge and across the different sectors and generate concrete plans for action. So there were over 60 people who attended the symposium. And as I mentioned before, people with lived experience, policymakers, service providers, researchers, we had students there as well. And the overall aim was to be able to, it was twofold. The first was to be able to identify barriers or gaps or challenges for people who are facing homelessness during pregnancy. And the second part of it was to be able to address priorities and recommendations for future policy practice and research. And so through the symposium, we aim to address the siloed approach to housing and infuse a needed gendered and intersectional lens into policy and practice. And so many connections were made at the symposium, and many remarked at how beneficial it was to be able to have this open exchange and dialogue across the different stakeholders. So these were the four main objectives of the symposium. So the first is to mobilize experiential knowledge and between the stakeholders. Then number two was to identify gaps in existing knowledge and try to reach a consensus about those gaps. Number three was to disseminate key messages. And then number four was to establish collaborative, interdisciplinary, and reciprocal partnerships. So even like I'm showing you here, there's some of the sticky notes on the side. These were sticky notes that were taken from the symposium during the afternoon session where we held a World Cafe. And I'll give some explanations as to how we ran the symposium for the day. So, but before I do that, I'm going to showcase a video for you. This video was premiered at the symposium last year. And the video was created from the PATHS committee, from the Young Parents No Fixed Address Network PATHS committee, with an animator. And it is using data from this qualitative research study that I held during COVID-19 with interviews with 25 different women and gender diverse people in Toronto about their experiences of homelessness. There's no dialogue in the video. This is meant to be like a hero story where there's an overlay between fantasy and reality with the images. You'll be able to see the images and sometimes it does take a few times to watch the video a few times over in order to be able to capture all of the different key components of what people who are facing homelessness are experiencing. And as I said before, I'm going to share the link with all of you so that you can please share this with anybody who you feel would benefit from receiving this information, and also for advocacy if you're wanting to get information across about this issue. I'll stop that there. So you can see that there's some information about this being conducted during, based on qualitative research that was done during the COVID-19. And as well, the statistics we have about the 300 births per year for infants being born into homelessness in Toronto. That was actually research that was done by Toronto Public Health in collaboration with the Young Parents No Fixed Address Network. So this video was really a combination of art and science to be able to address this crisis that we're seeing right now of homelessness during pregnancy. And like I said before, I'll share the link with all of you so you can watch it again if you wish to do so. So now going into the symposium, I'm just going to give a little bit of an overview, and then I'm going to have Stasia and Carolyn share some information with you. So these are some amazing photos that we had during the symposium and all of the key partners that came together. It was a very positive day, and the symposium was, the agenda for the symposium was comprised of morning presentations, and an afternoon World Cafe session. So the morning presentations included a presentation by Caitlin Schwan about a national overview of housing as a human right. We had a presentation about an environmental scan of all the shelters that were done, that were or in Toronto, Ontario. We had an overview of the homelessness birth count in Toronto, and we also had approaches to addressing homelessness during pregnancy in Hamilton, Ontario by the YWCA. So these presentations in the afternoon were followed, in the morning were followed by a panel presentation. So you can, the picture that's in the top right-hand corner is the panel presentation. There were 3 different service providers who were speaking, and 4 different service providers and 3 people with lived experience who were sharing their experiences of homelessness during pregnancy and some of the things that they're seeing either from the front line or from their own personal experience. And in the afternoon, we held what was called a World Cafe. So this was collaborative dialogue that was meant to be identifying gaps in practice concerns and policy limitations. So we broke up the symposium attendees into different groups. And so you can see that there's tables that were set up. And we had tables of 5 to 6 people, and it was a mixture of policymakers, people with lived experience, service providers, and there were moderators at each of the table, which allowed to have discussions on 2 different parts. So the first part was identifying challenges and barriers, and the second part was on identifying recommendations going forward. And so I'm going to actually turn it over to Stasia next, and then we'll then turn it over to Carolyn to share some of their experiences with the symposium.
Thanks, Barb. Hi, everyone. Please let me know if you can't hear me. It's very hard for me to tell if the speaker's working. Thank you, Karen. My name is Stasia Stewart, and first I thought I could just tell you who I am, or a little bit about who I am. So I work as the program coordinator of the 5 Ps program, which is a large multi-service perinatal and parenting program at Parkdale Queen West Community Health Center here in Toronto. Our program provides several drop-in programs for expectant and postpartum parents with children 0 to 6 years old. We host a food bank program, childbirth, infant care, and health education, provide infant and baby supplies and access to professionals like primary care, settlement, immigration support, social services professionals, both within and outside our health center. Outside of this work here, where I work full-time, I am also a labor and postpartum doula. I am a current graduate student completing a Master of Education focused on Black leadership in doula care and reproductive justice. I am a founding member of the Ontario Black Doula Society and a current board director of the Okama Collective, which is a birth worker collective that centers the doula and lactation needs, support needs of Black, Indigenous, and 2S LGBTQ and racialized communities in the Greater Toronto area. I'm also a mother of 3 children. And so thank you for having me today. So just briefly, I have a little bit more to share in the recommendations section, but here I just wanted to share how it felt for me to be at the at the symposium. I participated on the panel in the morning, and then I was very fortunate to be able to moderate one of the tables during the World Cafe. I personally felt like the symposium was wonderful and a really successful day. It combined service providers, volunteers, people who had experienced or were experiencing homelessness currently in pregnancy. And I think that the reason that it worked well, that the energy was productive and really positive, was because the voices of people with lived experience was centered, it was valued, and it was active, and it was not tokenized. There was a lot of leadership that was provided by some of the folks who took the time out of their hectic lives to attend. And that was really valued there. It was a really positive experience for me as a provider. I don't feel like, you know, the issues and problems were like solved in one day. There weren't magic answers, but there was a lot of enthusiasm to identify the challenges and strengths that exist and how to work better together. The discussion really delved deep into the issues and that impacted individuals' day-to-day experiences, while highlighting the intersections and the processes at the policy level, service provision, and service user levels. And because we were all at the same table, it really fostered a lot of connection and deep compassion. And for that, I feel really grateful for having been able to be a part of it. So I just wanted to share some of those thoughts. I really, you know, I think as a service provider, I've gone to countless conferences, and it is not always the case where people who are coming from the community and who are using the services have their value be valued the same way, or if not more, than those who are providing services. So now I wanted to pass it over to Carolyn, who is going to share a little bit about her experience. Take it away, Carolyn.
Hi, everyone. I hope you can hear me loud and clear.
Yes, we can.
Thank you. So my name is Caroline. I'm a mom with lived experience. So I'm really privileged to be part of this webinar and even the last year's symposium to just share my experiences with other moms and other stakeholders. And I must say I was really privileged to be part of the team and to, you know, speak out and create awareness on homelessness during pregnancy. And so today I'm also glad to be part of this webinar, and I'm going to share just some of the experiences that I had while pregnant and experiencing homelessness. So I came to this country when I was pregnant, and the first time I landed at the airport, I didn't know where to go and who to ask for help and how to navigate around. I remember I was stranded for 3 days before I finally secured a bed in one of the shelters in Toronto. This was after I was given a number to call in order to get a shelter, and I kept calling for days until finally I was lucky to get that spot. It was during winter, and I was 8 months pregnant. So the environment at that shelter was not so conducive for me. And I vividly remember I would not sleep at all during the night for the fear of being harmed by the guys who were sleeping next to me, because most of them were using drugs and others were mentally ill. And slowly my health started deteriorating. And unfortunately, by then I could not access medical care. I also lived in a lot of fear for child apprehension because I was told that the shelter that I was in, it was not a family shelter. And if I gave birth while I was still there, then I would lose my baby to children's services. I was also afraid that if I ask for help, it would even put me at more risk of losing my child, because maybe they would consider that as negligence. But fortunately, one of the housing workers in that shelter sympathized with me, and she tried making some calls, and fortunately I got a spot at a family shelter. And this, I was put on a waiting list, of course, for a month, and that is when I got a spot there. So finally I gave birth to my precious little one, and I was supposed to stay there a couple of months before I qualify for a housing program. So another challenge was less access to prenatal and postnatal resources. And at times I would not know who to ask, and I would call my caseworker, and I know I would overwhelm him asking him all these questions, because they didn't have much of the information. So I was stranded and I was stuck. So transitioning from the shelter system to housing was also another major challenge for me. And I had to start looking for an apartment. And I didn't have any information on how the rental system here works, because it's very different from where I come from. So the housing worker that I was assigned at the shelter, the only thing she could do was to process for me to qualify for the housing program, and I was supposed to do the rest. I remember I would, move around asking for apartment to rent, and I got a number of turn downs from several landlords. One, because of my status here in this country, and some would simply say they cannot accommodate a mother with a small child, while others would say they were afraid, since I didn't have a source of income, even after explaining to them that I was on social assistance and that the government would pay part of my rent. So these were some of the challenges that I faced while looking for a house to rent. And it was really tough, because I remember this time my little one was 2 months old and I could not afford Uber money. So I would move around with TTC, and it was snowing around. So these were the challenges that I faced. And my recommendation is that if we would have more support centers where newcomers, especially the vulnerables like pregnant moms and kids, would get information on how to get essential resources, and it would make it easier to navigate around. Also, I would recommend that if we would have enough trauma and counseling services, because I remember I was also going through some postpartum depression and I didn't know where to get help. So yeah, that is my experience, and I'm really glad to share with you. Thank you so much.
Carolyn, thank you so much for sharing your experiences with us. And it's been, we really feel that we know that your expertise and bringing your voice forward as part, it's needed to be part of this, collective group together to address this crisis that we're facing right now. And the experiences that Carolyn is facing, it's not, unusual. This is the same experiences that are facing multiple women and gender diverse people who are experiencing pregnancy, and especially in Toronto, where we do have a lot of newcomers who are arriving in Toronto. So thank you, Carolyn, so much for sharing your experiences. We're grateful to have you with us. I'm going to move on and talk a little bit about the barriers and challenges, and then as well as some of the recommendations. And I'm going to pass it back after to Stasia again, who's going to share more information. So when we looked at all the data and we we brought all of the summary sheets together. These are the key things that we saw. So siloed care, meaning that the different partners are not speaking with each other. There's a confusion between system and services. There's inflexibility of services, a lot of confusion navigating the shelter system, perpetuation of trauma, and that's something that Carolyn had spoken about. So that can be either from incomplete or inappropriate service provision during the perinatal period, and lack of implementation of harm reduction principles and misunderstandings of a safe opiate supply. So those are some of the things that were noted. As well, barriers exiting homelessness was another challenge. Immigration status, so for those who are new to Canada, had even more significant challenges and barriers. And there was a lack of personal skills related to self-advocacy and when navigating services. So in terms of some of the recommendations that we had coming through, so there have been calls for further integration of care, and that includes integrating services and creating clear pathways out of homelessness, a clear network to connect service providers with updates on available resources and best practices is needed, because some service providers may have access to some information, whereas other service providers will not have access to that same information and resources. And it's really conditional as to who your service provider might be as to what services you're able to access. So the strong need for trauma-informed service provisions, we need to develop strategies for exiting homelessness, more affordable and supportive housing, addressing these barriers to exiting homelessness, and as well as looking at further research. So for example, street needs assessment, that's an example of something done in Toronto in order to be able to include a question about pregnancy on that street and needs site, on that survey, as well as being able to enumerate the scope and the scale of this issue of homelessness during pregnancy. And that's something that we're trying to address through another research project as well. I'm going to pass it on to Stasia to give some great information from a service provider perspective.
Thank you. Yeah, I think that as service providers, we know about some, like, these recommendations are things that I think that many of us have been saying for a very long time. I think that working within this context where we know that and where we're trying to implement what we can where we can is challenging. I think that was a theme that came out of the symposium as well, is that the closer we were to the issue and to the ground, on the ground, the more that we understood what some of these challenges were. But did not necessarily feel like we could implement policies and guidelines that would actually move the dial forward in some areas. And so, you know, wanting to acknowledge that, and I think that we acknowledge that as a group here presenting to you all today too. So, you know, I think what we find in the work that I do is that it really, particularly in terms of implementing strategies for exiting homelessness and encouraging and supporting like trauma-informed services and practices, is that it requires quite a bit of flexibility, a lot of presence, and a lot of patience, and it really does require that we continuously find ways to like hand back power to clients, to families, and to individuals in the community by inviting people into the conversation to practice listening before speaking and seeing what we can learn about how to do something differently. I think when there is a trusting relationship, that leveraging that to support like autonomous decision making for people is really, really helpful. It's challenging. Sometimes people are very, very isolated and don't actually have a relationship anywhere that with someone, a provider or anybody that they feel like they can trust. And I think that in the face of that, as a provider, that like reminding ourselves that trust is not assumed, it cannot be forced, and that those who do not trust providers and services are drawing on crucial survival skills that help them navigate very rough terrain out there in the world. I think that, you know, on my team, we talk a lot about how to practice self-reflection, and how to engage with, you know, just the role that power and agency plays in our interactions and the way that we apply a policy or a guideline, and look at who's left out of the process when we're making decisions. Um, you know, working with people and thinking about the intersections of, you know, that exist in all of our lives, and that it overlaps a lot with a very significant period of time for people in that, particularly in postpartum healing, where connection to family, community, and comfort is tied to missing traditional spiritual and cultural wellness practices. You know, in shelter, if people are able to access a shelter bed, which in Toronto, the shelter, you know, shelter system is maxed and you wouldn't get a bed if you call central intake right now today. But in the spaces that do exist, there isn't access to clean water, milk storage, refrigeration, cooking in the room is not possible. That is very, very challenging for life with the newborn. And combined with that frequent movement that we saw showed up in the research and in the video that Barb showed, where people are moving on average 2 to 8 times within a pregnancy, this really, really negatively impacts on people's perinatal mental health and wellness. So that, you know, so that consistent theme of policies and guidelines that don't line up with people's lived realities really, really came through in the symposium. Recently at our program, one of our program received consent from a participant to share some aspects of her story, which really highlight this siloed theme that kept showing up. And this is from her perspective as an unhoused newcomer young parent. So the participant's name has been changed and all the identifying information for her has been changed in this story. And so I'm just going to read Carla's story for you. So Carla moved to Canada from Colombia in 2018. After her first baby was born, she moved away from her partner into a violence against women's shelter. When she got pregnant again with that same partner, even though we know so much about the cycle of abuse, she lost her violence against women status and was dropped by her legal team and needed to leave the shelter immediately. Her violence against women worker connected her to our program because they knew about the case management support that we offer, which she would lose in leaving the shelter, as well as the legal and mental health supports. In the shelter, while she was still there, her worker advocated for as long as she was able to help her get connected to services, despite feeling a lot of pressure from her manager to transfer Carla out of the shelter as quickly as possible. Carla described some of her experiences in the shelter as very racist. She was transferred to a temporary hotel shelter downtown Toronto, which was unsafe for her and her son. She did experience violence in the shelter, and she felt uncomfortable about being in such close proximity to quite a lot of frequent substance use. She is a Spanish speaker, so we helped her navigate calling central intake every week to see if there was a more permanent shelter space available for her. And if not, we helped her to call her Ontario Works worker, where they would release enough money for her to pay for 6 nights of shelter at a motel or hotel. Carla would then need to find a motel or hotel that had space and move there with the money. This cycle continued every 6 days until 4 weeks before her due date, when they said that there was a shelter space available in Scarborough, which is in the far east of the city, and she needed to go right away. That evening, she paid for her own Uber away from all of her support systems, her community, and her son's daycare with all of her belongings in garbage bags. Each week, her and her son would trek the 2-hour transit ride from Scarborough to attend our prenatal program, get access to childcare while here having appointments, access food from the food bank and donations, and meet with her case manager and Spanish-speaking counselor. She spent the whole day at our center when she came. This was the only place that she knew that whatever she needed, she could get with dignified, accessible care without judgment, shame, or discrimination. She was experiencing quite a lot of racism and judgment in her other programs and services, and this is where she felt she needed to come. Carla could not apply to housing and to many other services because she had not yet done her taxes. She could not do her taxes because she did not have a social insurance number. She did not have a social insurance number because she could not get her permanent residency status. She could not finish her permanent residency application forms because she needed a comprehensive health assessment. She could not get her comprehensive health assessment because you cannot finish the last step when you are pregnant. This also meant that she could not get access to essential financial support like the universal child tax benefit, which greatly contributed to her food insecurity. So we worked with our local legal clinic and settlement services to navigate some of these complexities with Carla. Navigating birth and postpartum was another set of challenges for her. Her case manager and her doula advocated for insurance coverage so she didn't have to pay for her hospital stay. And we found someone to stay with her son while she was giving birth. There are no funded services in the city of Toronto for a person who is giving birth who needs childcare. Carla's birth ended up being traumatic. 4 epidural attempts, an emergency C-section without language interpretation or a support person, and an excessive amount of bruising all over her abdomen, which showed up after birth and which was deemed by her doctors and providers as normal. She was discharged without having her obligatory 48-hour after baby appointment scheduled, and it was not explained to her in Spanish. And this appointment, sometimes if missed, potentially flags child protection services. We provided lactation support and supported her by scheduling her 48-hour after baby appointment. And we contacted the hospital to advocate for improved breastfeeding care and interpretation services. Carla had her baby and was no longer pregnant, so she got her permanent residency status completed. Her 2 children accessed daycare spaces and she looked for housing. She continued to experience challenges like discrimination from the shelter where she was leaving. Her Ontario Works income was not enough for a first and last month's deposit, and a letter from her shelter did not motivate landlords to rent to her. She considered her only option for adequate housing would be to return to her abusive partner. Our team saw Carla endlessly stressed, exhausted, overwhelmed, and defeated. She once commented to our team member that she is surprised that in a developing country like Canada, she sees animals treated better than human beings sometimes. So when decisions are being made about, so that's the end of Carla's story. When decisions are being made about programs, initiatives, and policies, it's important that we think about Carla and how these decisions support or remove her power and autonomy. There are countless stories like Carla's. I'm sure that you've noticed the overlap with some of the things that Carolyn mentioned in her presentation. These examples are not new, and the fact that they really continue to illustrate the long-term systemic inequities that pregnant people are facing out there. Our system has turned Carla and others like her into an advocate. Sometimes advocates arise as we look on our society and we see inequity and we want to help people. But often advocates arise from places of struggle where we do not want to see others experience what we have been through. So this is absolutely a human rights issue. And I think I'm going to leave it there.
Thank you very much, Stacia, for sharing Carla's story. And I'm going to wrap up our presentation now and just say, like, where are we off to next? What are our next steps? And so some of you might be aware of the 2 human rights claims that were already submitted to the Federal Housing Advocate by the Women's National Housing and Homelessness Network and the National Indigenous Feminist Housing Working Group in 2022. So the Federal Housing Advocate has been referred these women's human rights claims, and there's a review panel that is being put together. And so when this review panel is going forward, we are going to be making a submission for that claim. Essentially, what we're trying to say is that pregnancy and the perinatal period, so the moment somebody becomes pregnant until at least 1 year after they have their baby, if not longer, should be really named as a priority time for housing and housing policy, because it's not only woman or gender diverse person who's at risk. It's also the infant that's being carried and being born. So we want to make sure that there's going to be having the best start in their life. And right now there is no there's not a lot of research being done in this area, and there's no work that's being done in terms of advocacy in this area. So that's really why we're trying to bring this forward, and we hope to get a very committed group across Canada coming forward to join us in and bringing their voices forward. So that's the end of our presentation. I'm going to pass it back to Stefania now. She has a couple of more slides, and we will be taking any questions that you might have.
Well, thank you so much, Barbara, Carolyn, and Stacia. It's been amazing listening and learning about this symposium and the findings. And I'm so excited to hear that this is a human rights issue, because I could not agree more. And it's nice that we have some levers and mechanisms that we can look forward to really make sure our leaders and policymakers know that. So I have a couple questions already. We technically have about 5 minutes left, so I think we'll probably go past the hour a little bit. I do encourage folks to ask more questions in the chat. I will be monitoring that. The first question I have is, what are a few of the key learnings service providers and policymakers need to know so as to respond in the short and long term?
Okay, so policymakers and service providers. So that's two separate groups right there. So in terms of, I think with service providers, Stacia had already made a comment on a lot of those. So a lot of what we see with service providers is this being flexible with their services. So our network through the Young Parents No Fixed Address Network, whenever we have our monthly meetings, the one key common element that keeps coming across from all of us, everybody who's the service provider and their agencies, is trying to be as flexible as possible. So if they have age restrictions of who they need to deal with, they only go up until age 21 or to 24. They try to work so that they can create a system that will still be able to capture as many people as possible, even if they don't fit into that definition of that age category, but maybe they were pregnant before they were 24, so they're still able to be captured. And so the service providers are trying to be as flexible as possible. A lot of our services that are being provided are trauma-informed care from our network, but we don't see that universally being done until people are actually able to enter a lot of the networks or the agencies that are able to provide these trauma-informed and flexible services. It's a hit and miss whether or not you can actually get there or not. So I'm not sure if Stacia wants to expand on that answer at all.
I mean, I think for myself, obviously the team that I support is busy supporting the hundreds of parents, but I do think that I really do draw on the coalition quite a lot. I feel like I'm continuously learning from some of the other providers. So I think my default setting is try to work in coalition as much as possible and try to find those places where there is flexibility. So because I do recognize that some of the folks that we work with, they don't have that kind of flexibility. It's like, even some of the case managers internally are booked, and their schedules are booked like ages ahead, and they've got hour appointments, and they have caseloads that have to be maintained, and like it's very structured. And I think for community programs like ours, where we can say, well, why don't we do what we can do for your client, for the family that you're working with, and we can sort of shoulder some of that room. And so I find that I end up becoming like a bit of a bridge between like the advocacy piece of work and then the frontline supports that is offered. But I think that I do that because I'm able to be connected to supportive spaces like the YPNFA network. So I think that coalition work, that resource sharing as well. So when I'm sending messages, sometimes I'm sending messages about service provision, but sometimes I'm sending messages that are like, hey guys, one of our parents just had triplets. Dun, 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 dun. Anybody got a triple stroller? Like, can you drop it off in my office? So we also just share We also just share resources, and I think that's a start. I think that's a start. I think the other piece that I wanted to add to what Barb was saying was just that some of the policymakers at the table who came to the symposium talked a lot about how difficult it is to find time to stay connected to what is happening in the community, and that they get kind of stuck in their like policy land. So that was another piece.
Yeah, thanks, Stacia. That's exactly what I was going to point out, is that for policymakers, if they can keep their ear to the ground, basically, and having opportunities like this, they were invited to come to our symposium, but maybe policymakers can, try to as well seek out this information and being able to speak to people with lived experience and service providers, because they know what's going on and can make a lot of recommendations.
I apologize, Stefania and all. I must go because I have a meeting right at 2. But thank you so much for having me.
Thank you,
Stacia.
Thank you.
So we have one more question that I'll ask. We're just at the top of the hour, so maybe that's what we'll make time for. And if folks want to follow up with us, I'll drop our email again in the chat. And we're so happy to continue this conversation past today. The final question for you, Barbara, is do you think it would be safe or helpful to inquire about pregnancy status during street needs assessments?
So do I think it's safe to be able to inquire about that? That's a really, really good question. And we were just having that conversation, Stacia and I, yesterday, because we're talking about data that's being collected in Ontario about somebody who's labeled as no fixed address. And within our network of YPNFA, when we have those conversations with people with lived experience, we really try to have this safe space that's created to be able to have those conversations. Would somebody from a street needs assessment even have would they even indicate whether or not there was pregnancy? Would they actually share that information with us, because knowing that there might be a risk of apprehension? Chances are, no, that they likely would not be. And what I'm trying to say, like with our future research, is trying to say that, we want to expose these reasons for why people might not want to be, why we're not able to, like, say, enumerate or know the scope of the problem, because there's such a fear for people to be able to perhaps lose their child due to apprehension during the birthing process or right after they deliver. And so it's not just a matter of having a checkbox, but that is a discussion, I think, that needs to go forward. So if that was something that was to be put on a street needs assessment, what does that mean? What does that look like? How would that actually, how would that be interpreted by people? Would people actually fill it in or not fill it in? So it's not just a matter of just including the one checkbox onto a form. I think it's having a conversation to say, like, if that was included, why is it needed? And then if we did collect that information, what would we actually do with that data, and what would be done? So I think it was kind of a start to a conversation about not knowing the scope and the extent of the problem of what we're seeing, because there's so much hidden homelessness occurring for women's homelessness. So more people are not going to be able to be counted. So that is a project that we're working on in terms of, like, enumeration, but not just from the street needs assessment level, but it's looking at another database from the Ontario records of all births in Ontario, that actually there is an indicator on there of no fixed address. And we've put forward a grant to look at that and to research that, to understand, like, what does that count look like? What does it mean? What does it mean to service providers? And what does it mean to people with lived experience? So it's not an easy, it's not an easy question to answer, is what I'm saying. It's a loaded question if we were to include it onto the street needs assessment. But I think we need to start having those conversations.
Thank you so much, Barbara. And someone was just asking for the web address that was shared for YPNFA. Do you have
Okay.
that URL?
So it's ypnfa.org is I believe that's I think that's it. ypnfa.org.
Okay, thank you so much. And we will stop here. We will also be following up with everyone with a recording of today, as well as a PDF of the slides, which will have all the information shared today, as well as the video and references that Barb has and collected and is ready to share. If you aren't already, please subscribe and join the Women's Network. I've shared a link in the chat to do so. And just thank you all again for making time for us today. And Barbara, Carolyn, and Tastasia, who had to leave, thank you again so much for making time and sharing this wonderful information.
You're welcome. Thank you so much for having us, and thank you for joining us today.